Hello, everyone. We hope you are enjoying the conference so far. So for the next plenary, let's extend our warm welcome to Dr. Gladys Kalema-Zikusoka. Gladys received her Bachelor of Veterinary Medicine at the University of London Royal Veterinary College and a Master in the same field from the North Carolina State University. She then founded the Conservation through Public Health, a non-profit organization based on Uganda and in the US that conducts programs that protect gorillas and other wildlife from human and livestock disease risk. She is one of the leading conservationists of scientists working to save the critically endangered mountain gorillas of East Africa. Through her career, she was honored with multiple awards, including the Whiteley Award, the Edinburgh Award, President of Uganda's Golden Jubilee Award. She's not only an author of numerous peer-reviewed scientific publications, but she also wrote a book called Walking with Gorillas, The Journey of an African Wildlife Vet, which I highly recommend, by the way. So today she's going to give a talk entitled Conserving Gorillas Through One Health Approach. Thank you, Gladys, for being with us today. You can now share your screen. We are very excited to hear about your work with gorillas.
Thank you so much for inviting me today. I'm very honored to be at this conference and able to give a talk today. I will start off by sharing my presentation. Wait a minute. I'm not really sure. Are you able to see my presentation?
Not yet.
Oh, I've just seen, because my computer got reformatted.
Oh.
Okay. Okay, I'm here. Can you see it now?
Yes, we can.
Oh, great. Wow. Okay, let me put it into presentation mode. Thank you again so much for inviting me for this conference. I've been working with mountain gorillas for close to 30 years, starting off as a vet student in 1994, and then later on setting up the veterinary department as the first full-time wildlife vet in Uganda, my country. And later on, because of experiences I had, we set up Conservation through Public Health, which I'll talk about. And this led me to become an Ashoka Fellow for merging Uganda's wildlife management and rural public health programs to create common resources for both people and animals. And I look forward to talking to you about this through our One Health approach to gorilla conservation. I was very honored to become a National Geographic Explorer around that time in 2018. And in 2021, I was truly honored during the pandemic to be on the first scientific advisory group for the origin of novel pathogens. I'll start off by giving a little background of how I got into conservation. That's me at the age of 5 months. I grew up in a family where I was the last born in 6 children. And I guess by the time my parents had me, they let me do what I want, because actually veterinarians in my country are not as well paid as doctors or other professions, but they wanted me to do what I want to do with my life. they allowed me to do what I want to do, knowing that I don't have to worry about my elder siblings would be able to look after me. My dad was a government minister in the first government after independence, and he did a lot for the country. And through him, we developed a passion for wanting to develop Uganda. And this sadly is one of the last photos taken of him, because that's me as a baby. But this is one of the last photos taken of him with my family, because he was one of the first victims of the Idi Amin era. He was killed because he saw anyone in the previous government as a threat. And so we grew up with wanting to continue his legacy, and I wanted to continue it through my passion for animals. I first got to hear about the mountain gorillas when I was setting up the wildlife club in my high school in Uganda. And the Virunga mountain gorillas had first been discovered in the beginning of the century, early 1900s. And then the Bwindi one was discovered in 1987 when they were going through the forest and came across night nests. And they were able to look at the samples in those gorillas in the nests and compare with the ones in Virunga through a lab in California. And they confirmed that we also have mountain gorillas in Uganda. But it was going to take a while before I was able to work with them, because it took a number of years before they were habituated for tourism. But having grown up with lots of pets at home, and my elder brother, who was in the previous photo, always used to bring stray cats and dogs home, I felt like I wanted to become a veterinarian. And during my holidays at the Royal Vet College, University of London, I was able to come back home and work with chimpanzees in the Entebbe Zoo. And this zoo is actually 70 years old. By the time I went to work there, it was more like an orphanage where they had a lot of animals which were victims of the bushmeat trade, and they would bring them there, animals that were being trafficked. And so these chimpanzees, they would kill their mothers across the border in Democratic Republic of Congo, eat them, and then the babies were too small to eat, so they'll try and sell them to make money, and then they would end up at the zoo. And this taught me a lot about animal behavior, because these chimpanzees, when you were not looking, they would escape from the fence. They would open the fence because it was very flimsy and run around the zoo. They were only about 2 to 3 years old, but then they wanted to be carried back because they missed the hugs of their mothers. And it showed me how intelligent they are and how devastating the bushmeat trade can be. A year later, I got to study them in the wild in Budongo Forest under Professor Vernon Reynolds. And this was a really exciting experience for me. It was my first time to study wild animals. And over here, this photograph was taken two years after this, when I got to Bwindi. And as soon as I got to Bwindi Forest, I finally got a chance to study the mountain gorillas. This time I was in my 4th year of vet school, 1 more year to go. And this particular photo was not taken in Budongo, but at Bwindi, because as soon as I arrived, I developed a very bad cold, and I was not allowed to visit the gorillas because we can easily make them sick. And at this point, we only had 2 groups habituated for tourism and 1 group habituated for research. And so I had to get better naturally, and I took this photo when I went for a walk at the waterfall. But I basically got into primate conservation through research, and that is the best way to get into conservation. This was the first mountain gorilla that I saw. He was on his own that day, which is unusual, but we couldn't locate the rest of the members of the group. The rangers and trackers couldn't locate them. It was a magical experience. It's not such a great photo of a gorilla, but it was my first photo. He was chewing on a piece of bark. He had a broken hand. That's why he was called Kachupira. And when they were habituating the gorillas, he already had a broken hand. We don't know whether it was due to a snare injury or something, but he was able to operate with it. And he was very accommodating around us. He was really relaxed, even if he was on his own, and there were a group of about 6 people watching him. And this made me realize how vulnerable they can be and how few they were in number, because when I got there, there were only about 300 mountain gorillas in Bwindi. The number has grown 1.5 times since that time. And so I just felt like we need to protect them because we can easily make them sick, and they're so few in number. My research involved collecting fecal samples from the night nests. Gorillas build a nest every night, and just as they're getting up in the morning, they defecate in the nest. And from it, we're able to collect non-invasive fecal samples. because I was based at the tourist side of the park and not the research side, I learned a lot about how tourism can support conservation. So it was a very good lesson in conservation medicine. Of course, tourists were all told that you have to keep 5 meters away that time. You have to be at least 15 years old. You're only allowed to visit them for an hour, and you're not allowed to visit them if you have a cold. The rules have been upgraded slightly since that time, but they generally are about the same, and they've become much stricter. And I'll talk about why they became much stricter over the past 25 years. But also I saw how tourists are really supporting the gorillas, because a lot of people the money from tourism was paying for jobs. 90% of the staff were from the local community. Community members could sell crafts and accommodation. And it was really lifting people out of poverty. But at the same time, there was always that worry that as human beings, when we get really close to the great apes, non-human great apes, we can easily make them sick. So I wrote to the head of the national parks and I asked him if I could become their first wildlife veterinarian. And I told them what a wildlife vet does in wildlife, because at that time, there were no veterinarians working in conservation, wildlife conservation in Uganda, because in those days, it was considered that you don't touch the wild animals and you leave everything up to natural selection. But of course, we've been already disrupting them too much because of habitat loss, cutting down their habitat, getting close to them, habituating them for tourism where we can make them sick. So it was obvious that you need a veterinarian, and that's part of the reason why Dr. Eric Edroma, the head of national parks, said to me, come along, we're waiting for you. We'd love to have you to start working as our first veterinarian. So one of the first things I had to deal with was deciding when and to treat gorillas and when to leave it to natural selection. For example, if two gorillas are fighting, should you intervene? Because it may be time for another one to take over the group. And it's normally the dominant silverback in a gorilla group that mates with the females. So are you preventing new genes in an already endangered population? There were all these arguments, but we all felt that we should intervene if it's human-related or life-threatening. And so one of the first cases I had to deal with was a scabies skin disease outbreak in the gorillas. And they told me they were losing hair and developing white scaly skin. I was lucky that around the time that it happened, this veterinarian, Dr. Richard Koch, happened to be in Uganda because he was helping me to evaluate the veterinary needs for the Wildlife Authority with support from World Bank. And so he came over and I said to him, could we please first go and attend to the sick gorillas before you continue to go through all the other national parks? And he had seen cheetahs in Masai Mara that had similar symptoms. And there were cheetahs that were visited by very many tour vehicles. And he attributed it to stress because the ones that were not visited were fine. And by this time, this particular group had only 4 gorillas and 6 tourists were visiting because some of them had broken off and gone across the border to DRC. So I did travel from Kampala, which was a 10-hour drive with ivermectin, thinking it could be scabies. And we got there and it turned out to be scabies. And so what we did is we were able to dart the juvenile and treat him. He's 6 years old at this point. But sadly, the infant that was worst affected was dropped the next day because the mother was too shy for us to treat the infant that day. The mother was also losing hair and so was the silverback. And when I did a postmortem on this gorilla, the body was still, the mites were still alive, even after the gorilla had also died of secondary pneumonia. Then we also had other cases that we started to think it could be human related because even before I went out to treat the gorillas, I asked a human doctor friend of mine, what's the most common skin disease in people? And she said it's scabies because low income groups of people in Uganda don't have adequate hygiene and they end up having preventable diseases like scabies. And this particular group was always going outside the park to eat people's banana plants, having had the habitat cut. And so we also had a disease like this one where we didn't know whether this particular gorilla picked up a human parasite, which made her trained to defecate. And then it resulted in the rectum coming out of the body. In the end, I had to operate on her because if I hadn't, she was going to die. So I operated on her on the grounds that it's life-threatening, but we were not really sure whether it was human-related. She got better from the operation. She recovered, and being a female, she went on hopefully to have 6 babies. But later on, she joined an unhabituated gorilla group so we're not able to track her. But at least she recovered from the operation, and now everybody thought, yeah, it was worth doing the operation. This is what typically happens when the gorillas go to people's gardens, they eat their banana plants. And we think that that's how they picked up the scabies. When they went to people's gardens, they found dirty clothing on a scarecrow, and they probably touched it because they're curious, and the mites spread through the group. You know, they put out dirty clothing, which is infected with mites or any other fleas and all kinds of things. And that's probably how they picked up the scabies. Gorillas normally like to eat the plant because they like the moisture in the fruit, which really upsets the local community, but they also sometimes graduate to the fruit. And so we started to think that human-wildlife conflict is actually leading to cross-species disease transmission. And that's how my One Health journey really began. They asked me, as the only vet in the organization at the time, that they wanted me to start some health education workshops, because they said when gorillas go to people's gardens, they also find not only dirty clothing on scarecrows, but they also find rubbish heaps are not covered. They find, open defecation. There's all kinds of things happening. And they wanted me to set up a health education program for the local communities to prevent human and gorilla disease transmission. So we distributed over 1,000 brochures in English and the local language. Most people could only really read and write in the local language. We went to 8 villages with over 1,000 people. And these are villages where gorillas were regularly coming out. And of course, this man in the photograph is complaining that, but these gorillas are eating my crops, and it's not my fault that people are making them sick. So it was really interesting for me as a veterinarian to meet with people, community members, because I was only just dealing with sick animals and not really meeting the local community. Because when we met with them, I told them what the problem was, how the gorillas got sick. And I went together with rangers, community conservation rangers and wardens, who talked to the communities about the benefits of the park. And I went with the sub-county health assistant who deals with public health from the local hospital. So I told them what the problem was, and I was about to tell them what the solution is. And the ranger touched my arm and said, let's hear what they have to say. And they came up with a lot of interesting suggestions, which showed that they were listening to what we were telling them. And they had better suggestions on how they can prevent cross-species disease transmission than even I was proposing for them. And that to me was very humbling as a veterinarian, but it showed me that people know what's best for them. You don't propose ideas on them. They know what's best for them. All you do is facilitate them to come up with ideas that work best in their situation. And some of the things they said was they want continuous health education. These little boys were supposed to be in school, but they were grazing goats just outside the forest. And they also wanted health services to be brought closer. When somebody falls sick, let's say they're staying here, they have to be carried all the way up the hill to the road. And then they carry them on a stretcher for another 10 miles or 20 miles to the nearest health center. And they wanted health services to be brought closer because sometimes they get there when it's too late. They also said we should strengthen the human gorilla conflict resolution team that herds gorillas back to the park when they come out with raincoats and gumboots. And a lot of what they proposed in 2000 and 2001 is what we're doing now in our nonprofit Conservation Through Public Health. In between, I did a zoo medicine residency in North Carolina, and my research was looking at tuberculosis at the human-wildlife livestock interface. I got an opportunity to work with captive gorillas in zoos, obviously much more sophisticated equipment at the North Carolina Zoo. And I came back in the holidays and we collected samples from buffalo, cattle, and people to see whether people are getting Mycobacterium bovis from drinking milk from cattle that's not boiled or from eating buffalo in the park that have been poached, or if they're getting MTB from themselves, which could then also spread to gorillas. So it was a very interesting study and showed me how the public health system works. We found that 25% of people with chronic coughs had tuberculosis, which is really a threat, especially to the mountain gorillas, because you can't treat them for 8 months, they'll become dehabituated. And so we started CTPH shortly after that, together with my husband, who's a founder member, Kalema-Zikusoka, and Stephen Rubanga, who's a vet technician. And one thing that we can't ignore as you get to Bwindi is the habitat loss is one of the biggest threats to the gorillas. You drive up to here and it's a hard edge. The gorillas can easily come out. People aren't supposed to go in unless it's legally for tourism research, or in a controlled manner. They call it multiple use, where you collect honey, basket weaving materials, medicinal plants, if you're given permission. They call through the multiple use program. And poaching is another issue. People in Uganda don't eat gorillas, but when they cross over to other countries, like DRC, they could, because it's considered a delicacy in some parts of DRC and other parts of Central Africa. They think if you eat a gorilla, you can become as strong as a gorilla. But in Uganda, the hunter-gatherers who lived in the park, it was bad luck for them to look in the eyes of a gorilla. So they used to avoid them and they wouldn't eat them. And it was bad luck to eat a gorilla. So that's what would happen over there. This is one of, but why poaching is a big issue actually is because people still like to eat duiker and bush pig, and they put out snares for the duiker and bush pig, and they also spear the duiker and bush pig from time to time for food, and gorillas either get caught in snares or get speared, which is something that has happened in the recent past. This particular gorilla is one of my favorite. I knew him since he was a baby. He was born in 1996 when I started working as Uganda's first wildlife vet. And he grew up to become a big silverback. I took this photo when he was now a big silverback, Kanyonyi. And because he was so used to tourists and people, every single day of his life, he was seeing tourists. When he became a big silverback, he continued to be playful and he would jump at tourists to see their reaction. And this kind of showed, again, how tourism and gorilla conservation has moved forward, that gorillas are so relaxed around people, but also signified the threats that they were facing because they get too close to people. So we founded conservation through public health to keep the gorillas and other wildlife healthy and their habitat secure. This is the view from my office in Bwindi. It's really beautiful, lovely office view. And inside here, we don't only have gorillas, but we have chimpanzees, elephants, pangolins, duiker, bush pig, over 200 species of butterfly, and over 300 species of birds. And it's also a very important water catchment area, providing water for people all along, many miles away. And also it's a climate modulator, because where you have forests, you know that the climate is more stable. Although Bwindi is also beginning to get affected by climate change with unpredictable weather patterns. We have 3 integrated programs: wildlife conservation with a focus on wildlife health, community health with a One Health approach, focusing more on issues that affect people, animals, and the environment together, health issues, and alternative livelihoods, which we started because we found out that many people are unhealthy because they're poor. And we also needed to look at livelihoods, and we focus on livelihood issues that other NGOs are not focusing on. So we train the rangers to monitor the health of the gorillas, basically to identify them and know which one is sick, and collect fecal samples from their night nests every month. Every month we collect samples from all habituated gorilla groups, where we started off with 3 in 1994, and now we have 28 that we have to keep following. And we get the rangers to collect the samples most times, or some of our staff, and we check. Collecting fecal samples actually involves measuring the fecal sample, which helps you to know whether it's an infant, juvenile, adult female, blackback, subadult, or silverback. And sometimes you know the actual individual who passed the sample. That's the most useful sample. But sometimes you just want to know generally what's happening in the group. Do they have an infection? And sometimes you can only measure them, can only identify them through the age, sex, class. So we built a field laboratory first in 2005. This is the US ambassador with his wife, Steve Browning and Sue. And then later on, we upgraded to a more permanent gorilla health and community conservation center. And at these centers, we analyze samples mainly from gorillas, but sometimes from people and livestock to try to do comparative analysis and prevent cross-species disease transmission. This is Stephen Rubanga, our 3rd founder member. We sometimes host students and we do all kinds of tests, mainly parasitology. And we're currently going to be doing regular bacteriology and virology. During COVID, we collected samples to test for COVID, and we keep on collecting samples for different emerging issues that keep coming up. And so we're finding that when we carry out these comparative disease investigations, it helps us to monitor the gorillas and also evaluate the impact of our community health programs. where we are seeing that over time, as community health is improving, gorillas are falling sick less often from preventable diseases like scabies, giardia, which I'm going to talk about later in the presentation. And so gorillas share protected water sources with people. Over here is basically a micro hydro dam that was built in windy forest to provide electricity, because the forest is also important for water, as I mentioned earlier. But then what you find is that gorillas cross these streams, people cross these streams, and they can get sick. This is an example of a stream that's shared by the cattle. You know, the cattle, the people bathe in it, the cattle defecate in it, and gorillas cross it. And there's potential for giardia, cryptosporidia to spread between the three. So we did a study looking at giardia and cryptosporidia in the gorillas, the people, and the livestock. And we did find in this study that giardia had disappeared in this particular study, but cryptosporidium was still there. But giardia was quite high in the human infants at the hospital, where 40% of them had giardia. And so we're able to talk to the hospital about educating the families, the mothers and the fathers, to boil the water before they drink it, which then would reduce the giardia in the children. And we spoke to the cattle keepers and helped them to build cattle water troughs so that their cattle don't have to defecate in the streams that everybody else is sharing. Cryptosporidia is something also that happens. And what we did is the areas where we found crypto in the gorillas, we recruited another community volunteer, village health and conservation team member, to make sure that people's behavior is continuing to change and they're more healthy and hygienic and they can reach more people. This is something that happens still even now. This video was just taken 1.5 years ago, and this particular gorilla left the community land. Left the forest to go into the community to eat people's banana plants. It's a blackback in the southern sector. And so this tends to happen a lot still. And as long as this is happening, we can't only monitor the health of the gorillas inside the park, but also outside the park. And to monitor their health, we need the support of the gorilla guardians, who I talked about earlier when we first met the communities. So they're the people who are trained to safely herd gorillas back when they come out. And we train them to also collect fecal samples from night nests of gorillas outside the park and monitor the health of the gorillas. And that's what's happening here. And over here, we also engage communities in conservation by working with half women, half men in this area. Half of them are women, half are men. And we basically go and carry out a lot of behavior change in people's homes. So I visited Rehema here. She was with 3 other community members, and we were talking to them about how they can carry out behavior change communication in people's homes. And they talk about good health and hygiene, adopting hand washing stations, adopting family planning, because when you have manageable families, then you are better able to give them healthcare, and you don't have to enter the forest to poach because you have fewer mouths to feed. You don't have to collect firewood as much. And also they talk about referring people who are sick for things like scabies, TB, HIV. They talk about the dangers of eating bushmeat, which can make you sick, like the animals in the forest, and how they can easily make gorillas sick if they don't keep healthy and hygienic. They also talk about how they can access tourism revenue and nutrition and sustainable agriculture. So it's a whole package that they take to the communities. So we started off by training 26 village health and conservation teams in 2007. And when we started the program, 4 years after CTPH began, we started to train them to do family planning as well. And this is a local health center. We're glad that half of them are men and half are women. It just happened. Later on, I realized it was very important for gender, because men are getting more involved in healthcare and family planning, and women in conservation and natural resource management. This particular lady, Dr. Lynn Gaffikin, helped to set up our public health programs, especially the family planning component. And she came over when USAID gave us funding to add family planning to our model that was preventing tuberculosis between people, wildlife, and livestock. And at that point now, we had 270 volunteers reaching 40,000 people in 7,000 homes. The program has grown significantly, and women are able to stand up and talk to a group of men, which never used to happen before. Because when we went out to do the health education workshops, no women spoke, but they were whispering amongst themselves that they need to educate their daughters so they can stand up in a group of people like I was and lead a team of men. So we're glad to see that there's a lot of female empowerment through our One Health approach to gorilla conservation. And over here, basically, you have the bad family. You have too many children. They're all, half of them are going to school, half of them are staying behind. And a lot of this was developed through focus group discussions, working together with Mbara University, which has medical and nursing students who talk to the communities, and they said, I have 10 children, half to go to school and half are for chasing wildlife from the garden. And so when the wildlife comes, the family that's really overwhelmed because they can't cope, they try and chase away the gorillas. Some of them get hurt. And this is all based on reality. People have ever been scratched by gorillas, and gorillas have ever got sick by having close contact with people. And later on, the boy, they have teenage pregnancies, they get arrested for poaching. Some of them die early, they abandon their wives, when the boys end up having teenage wives, and it's a disaster. Whereas the good family has 4 children, they plan for them, they all go to school. When the gorillas come out, they call out the HUGO, Human Gorilla Conflict Team, to herd them back so people don't get hurt, gorillas don't get hurt, and they herd them back safely. And later on, the boy becomes a ranger, the girl becomes a nurse, and they're at the graduation party. And of course, everyone would rather be the good family, and this has really changed behavior. We found out that the most popular contraceptive was the injection rather than the pill. And so we teamed up with Family Health International and became one of their pilot sites to test the feasibility of lay community health workers like her, Rehema, in her home, safely giving an injection without any reaction. And this really helped to double the family planning rates. We started to sustain them with group livestock projects. They asked us for goats, cows, and Stephen thought we should make it a group activity that brings them together based on his experience in Ministry of Agriculture as a vet technician. And this really worked because 14 years later, these groups are still going. And when CARE was promoting village saving and loan associations, they reinvested them in village saving and loan associations, and they've kept on going. And we've continued to carry out the family planning. This is now Hope. Someone came to her home to get an injection. We scaled up the program to Democratic Republic of Congo, where people are even poorer. And as much as it's a largely Catholic country, they really embrace the family planning program because they want to reduce poverty in their home. So this is actually somebody's kitchen and somebody's home. Over here, we find many more homes are temporary. They're mud and water with straw roofs, grass thatch roofs. Whereas in Uganda, because of tourism, we're having more and more permanent homes with iron sheet roofs. So tourism is really helping to lift people out of poverty, but has to be done very carefully. This particular student, Alison Haynes, she came to us from Oxford Brookes University in 2011, and she was interviewing tourists to see their willingness to put on masks. This was like 9 years before the pandemic. And about 53% said they were willing to put on masks. Another student came a few years later, and the number went up from Ohio University in the US. And so we're finding that over time, they were beginning to realize, oh, we could make them sick and we need to be careful because people were getting too close to tourists. And this led to policy change during the pandemic, which I'll talk about very soon. We've presented at family planning, we've talked about our family planning work at the Woodrow Wilson Center. And this holistic approach to conservation found that we're getting support from different sectors, and it's been really exciting. We're pleased that the mountain gorilla populations are steadily increasing, and that removed them from being critically endangered IUCN to endangered. They're one step away from extinction because of a lot of a concerted effort of the government that has been able to allow tourism, and the rangers who follow them every day, and the money from tourism not only pays the rangers' salaries to prevent poaching and to monitor the health of the gorillas, but also that money from tourism goes to the local communities. Improved veterinary care has had a big impact for sure in Uganda, Rwanda, DRC. I mean, especially Uganda and Rwanda, where gorilla tourism is really thriving, and there's a lot of activities going on. But also community engagement is much better. They're benefiting from tourism, research is much better. And it's a concerted effort of all the stakeholders, including the tour operators who bring the tourists. I participated in the very first census here, where we counted 300 gorillas to add to 315 Virunga. So when you see this big jump, it's because Bwindi gorilla census was finally carried out. And we hope that the numbers are going to keep growing. The next census is happening early next year. It delayed, normally it's carried out once every 5 years, because to fit in with the interval of gorillas, but because of COVID, it was delayed a bit. And so how do we sustain these conservation efforts? Something that we started was Gorilla Conservation Coffee in 2016. My husband thought, why don't we start a global coffee brand to save the gorillas? Because whenever you're going to visit the gorillas, often you cross coffee farms. And we really discovered that these farmers were not getting a fair market or steady price. So they were still entering the forest to poach. And this could have health impacts on the gorillas as well as setting out snares and disrupting their habitat. And so we started to work with them, and Gorilla Conservation Coffee is almost 10 years old. Basically, we named the first brand after my favorite gorilla, Kanyonyi. So this is a stylized photo of Kanyonyi, and it's available all over the world. Well, not all over the world, but in Uganda and Kenya, US, New Zealand, UK at the moment. And it won 92 points on Coffee Review among the top 30 coffees they reviewed. So it's great coffee. But the most important thing is it's helping to protect gorillas. So a donation from every bag sold goes to support the work of CTPH, improving community health, gorilla health, and conservation education. And UK, this is Vicky, one of our biggest buyers. And this is the airport duty-free shop where another of our biggest buyers in Uganda. So during Gorilla Conservation Coffee, we found was very helpful during the pandemic because tourists could not come anymore. But tourism is the biggest way that conservation efforts are being sustained, although it has to be done carefully. So this is a photograph taken in 2011 when tourists had to be 7 meters away from the gorillas. The rangers explaining what 7 meters is, and they're visiting the gorillas at 7 meters. But this is very rare. We found that when we conducted research with Annalisa in Ohio University, that 60% of the time, tourists got too close to gorillas, not even 7 meters, closer than 7, but closer than 3, in spite of being told 98% of the time that they shouldn't get close to gorillas, and 85% of the time, the reason why, because of cross-species disease transmission. But 40% of the time, the gorillas are the ones that broke the rules. They were curious, they come close to the people. And so this was becoming a big issue. And that's why we kept on thinking we need to have mask wearing. Then comes the pandemic in 2020, and it forced the issue because if you remember, social distancing, hand hygiene, put on masks, those same messages had to come out much more clearly to protect the gorillas and the chimpanzees. So we held a workshop with everybody and advocated for the wearing of masks. It was the first day everybody put on masks. You notice most people are wearing cloth masks that day because Uganda had run out of surgical masks at the beginning of the pandemic, just like many other countries in the world. And this fitted in with IUCN guidelines that they had been pushing for many years and the Gorilla Pathology Specialist Group. So at the beginning of the pandemic, during the pandemic, we also measured temperatures to detect subclinical infection and hand washing. So we really stepped up all these regulations. At the same time, we were testing the gorillas and the people for COVID. The gorillas through non-invasive fecal sample collection, and the people were being tested through the local health centers. And these were all people who come close to gorillas were tested regularly. And we joined the Ministry of Health COVID task force, where we were considered essential workers during the pandemic because of our One Health approach to conservation that was not only preventing COVID among people, but preventing COVID between people and gorillas. And so we trained our village health and conservation teams and gorilla guardians in COVID mitigation, and they did a lot of behavior change. A lot of people adopted hand washing stations. And this was like when we're only allowed to have 5 people meeting at one go through social distancing. The country was only allowing gatherings of 5 at that point. And we also distributed these posters. And when people are herding gorillas back, they have to put on masks. During the pandemic, sadly, we lost Rafiki. He was the lead silverback of Nkuringo Gorilla Group, which is one of the first groups to be habituated in the southern sector of Bwindi. And he died because people were really struggling during the pandemic. They had no food. There was a lack of, they were using the money from tourism to buy food, but there were no tourists because of global lockdowns and the economy went down. And there were no tourists also to protect the gorillas from COVID because we really weren't sure what was happening in the first 6 months. We had to leave 6 months for all the protocols to come up before tourism could begin again. But as you can see, this poacher who killed Rafiki, he did not kill Rafiki because he wanted to eat Rafiki. He wanted to eat duiker and bush pig. So he was caught with all this equipment at his home. And basically he speared the gorilla and the gorilla screamed because he first of all speared the bush pig, the gorilla charged to protect his family, then he speared the gorilla out of self-defense. So he went to jail for 11 years, which is the longest anyone has been in jail in Uganda for killing wildlife like that. But we decided we needed to meet with the reformed poachers who were people who had laid down their tools and said, we're not poaching anymore, but we need an alternative livelihood. So we're supporting them with group livestock projects. And we met with them that day because a few weeks after, because it had now become a huge concern. We didn't want other gorillas to be killed. And they came with their wives, some of them, and they said that they sometimes pressure their husbands to poach to put food on the table. So it's very important to meet the women and the men together. And when we went to check on Rafiki's group, I went with a porter to carry my luggage. Porters hadn't had a job for a while because they were making a lot of money just carrying somebody's luggage, a tourist luggage to the gorillas. And he was wearing a mask saying, in memory of Rafiki, because everybody was upset that this poacher killed Rafiki. And this group had now decreased from 17 to 11. And gorilla group. Not only, and it was so disrupted because now the head of the group wasn't a silverback and the females left, apart from the ones with babies, because their babies would get killed in another group. But eventually they settled down and started having babies and the group has settled down. But we realized that there are going to be many more people poaching because they're hungry and we need to provide fast-growing seedlings. So as much as we're not an emergency outfit at CTPH, we did want to provide emergency food relief during the pandemic. We did provide fast-growing seedlings that can grow within 1 to 4 months. We gave them to the most vulnerable homes, including the poacher's wife, who was only 22 with 3 children under the age of 3, and one of the poorest of the poor, just to make sure that she's well fed and she doesn't have to be so desperate and other poachers don't have to enter the park. And this is an intervention we've continued beyond the pandemic. We currently distributed now to 3,000 households around the park. And so I'm going to end by talking about our model household approach, which is something we began in 2022. And basically, we decided to come up with 12 ideal indicators because originally we were just looking at things like, which were very important. Hand washing stations went up from 10% to as much as 75%. And also you found that people are now using drying racks and they had pit latrines. But then you'd sometimes find that somebody has a hand washing station, but they don't have a food crop garden and they're still entering the forest to poach. And so we thought that let's try and develop model households that have everything, ideal hygiene, they're adopting family planning, they have a food crop garden, they're covering their rubbish heaps, they have everything that they need so they don't have to depend on the forest. And this in turn would lead to a reduced disease threat to the gorillas because more and more people will be healthy and hygienic. If gorillas go to their gardens, they're much less likely to get sick and they're more likely to call the Hugo members and gorilla guardians to herd them back. If they have a cash crop like coffee, even better. There's much less need for them to enter the forest to poach. And we feel that all of this would lead to an increase in the mountain gorilla population, both in the habituated and unhabituated gorillas. And so we now have 430 village health and conservation teams reaching over 50,000 people in over 10,000 homes. And we saw that over the past 1.5 years, we started off realizing that we had only 22% red homes, 23% green, 55% were amber. And the way it comes about is that you have a red home if you have only up to 4 indicators, an amber home if you have up to 8, and green up if you have up to 12. And so over time, we've been happy that it's really increased. And we've had an increase in green homes from 23% to 58% over the past 2 years, which is fantastic. And ideally, we want all the homes where gorillas come out, on all the villages and parishes where they come out to be green homes. So this has been a better way for us to measure our impact. And it's made it also easier for donors to understand how we're making an impact. And we want to track also to see how this is resulting in less diseases from local communities in the mountain gorillas, which we're seeing a bit of, but we're tracking it more closely now, and less poaching and going into the forest illegally through records from the Wildlife Authority. Responsible tourism is something that is really close to my heart. And we encourage tourists to put on masks. Well, they have to now. It's a rule, it's a regulation, even beyond the pandemic, because we want to prevent them getting other respiratory diseases, even if it's not only COVID. And also we encourage them to buy a mask, a craft from a local community member, because once a local community member meets a tourist and they buy their crafts, they're much less likely to enter the forest to poach. We developed a website, Protect Great Apes from Disease, during the pandemic. And we launched a policy brief on responsible tourism to great apes for not only Uganda, but all the countries in Africa that have great ape tourism. 13 countries in Africa have great ape tourism at 33 sites. And we launched it at the first Africa Protected Area Congress in Rwanda, IUCN conference. And at this table, you can see we don't only have people who are working as zoologists, like the chief warden of Bwindi, and Dr. Emmanuel Normand, who is heading a chimpanzee conservation program in Ivory Coast, and the deputy director of Rwanda Development Board. But we also had tour operators. We had Praveen from Volcano Safaris and Manzi from Wilderness Tours. And we launched this policy brief with International Gorilla Conservation Program. We are excited to engage women in conservation. I think it's really important. I actually write about it in my book. I have a whole chapter on engaging women in conservation, in working with gorillas. It's very important. And when this was the first day that we were all wearing masks when we went to the gorillas. This is one of our head rangers, a woman who's extremely dedicated and motivated. And when they stand up to talk to the local communities, like we engage them at conservation through public health, they really get involved in conservation and they change their communities. And so we've hosted students from Duke University to look at the role of women in conservation as well. I'm on the Leadership Council for Women for Environment Africa, where we're trying to mentor women to become leaders in conservation and realize their leadership potential. My fellow founders, it was initiated by Dr. Leila Hazza, who founded Lion Guardians. And all of us here, we are either founding our own organizations or have got to senior management positions, but some of the people have got to them and they didn't get to the top because they were women. And so this is a very important group, and we mentor all these people over time. We're also strengthening African leadership in primate research and conservation, because if you don't have people from where the wildlife is from looking after their wildlife and taking a lead in it, the wildlife doesn't have a secure future. And so we hosted a second conference in Entebbe in Uganda, and we had over 300 delegates, of which 85% were native Africans. Whereas normally when you go to the International Primate Society conference, only 10% are from where the wildlife is from. And we had the ambassador, Natalie Brown. She was the US ambassador to Uganda at the time. We took her to the gorillas. She loves animals. And she became a big advocate for mask wearing. She tweeted about it. And now everyone knows mask wearing is the in thing to do. We engage children in conservation. My son, Indigo, actually worked at the zoo. He volunteered when he was 13 and looked after the animals in the zoo and wrote an award-winning book in America, Zookeeper, for a week. His younger brother, Tendo, during COVID, wrote this article about COVID-19 and gorillas in the Children magazine, because he accompanied me on so many workshops. He became an expert on COVID and gorillas, but it's so important to educate the next generation. And we've got funding from National Geographic and worked with Global Green STEM as our technical partner to try and get students from Bwindi community to come up with programs to reduce the rubbish around the park, because gorillas, baboons, other animals end up picking up diseases from this. They're also setting up livestock projects so that they don't have to enter the forest to poach. I was very honored to become a 2021 UNEP Champion of the Earth for a One Health approach to conservation. The year before, another One Health advocate, Dr. Fabian Leandetz, also won this award. And one thing that I really emphasize is we need more local champions, because they're the people who become decision makers, and we want them to make good decisions. I was truly honored to get an honorary doctorate for our mountain gorilla work, conservation work last year for my old alma mater, the Royal Vet College, and excited to win awards from various groups, Leadership Award, Indianapolis Prize for Animal Conservation, most recently Mammal Society President's Award, and also to be among the BBC 100 Women, where I was in the Climate Pioneer category. How can you get involved? Spread the word about our work, partner with us, sign up for our monthly e-newsletter, make a donation, follow us on Facebook, Twitter, Instagram, LinkedIn, TikTok. We're now on TikTok as well. Do research and field training of student groups. This is a student from India who was talking to the community members. Buy gorilla conservation coffee, buy Walking with Gorillas. And I hope you get to learn about my conservation and leadership journey. And I felt like it was so important to write this book because I'd had very many unique experiences. And we're glad that it's available all over the world. It was first published in US, but it's available in UK and many other countries. And thank you so much for listening to me. We're excited to celebrate 20 years of conservation through public health last year. And we look forward to another 20 years where we're scaling up our approach beyond Uganda to other countries in Africa, working with local partners, especially where gorillas are found, and also expanding the park of Bwindi so that the gorillas have more space for their population to keep expanding. Sorry, I'm only leaving 10 minutes for questions, but I'm looking forward to your questions. Thank you very much.
Thank you, Gladys, for this wonderful talk. I think it was like heartbreaking and amazing at the same time. It's new to me. So for people who are listening, you can now ask questions on YouTube, and I will be able to ask your question to Gladys. So we already have questions. So one from David. So what is the future path for conservation of gorillas? How will you be able to build on your success?
Thank you so much for that question. I would say that the conservation of gorillas, the mountain gorillas is much more of a brighter future because people are benefiting from mountain gorillas. Like currently now, the revenue from mountain gorilla tourism is contributing 60% of the revenue for all of the national parks in Uganda. And some of that money even goes to support other protected areas that have important species like cheetahs, but they don't have enough tourists. So as long as the gorillas make economic sense, their future is secure. But unfortunately, it's only for the mountain gorillas. The other gorilla subspecies, Western lowland, Eastern lowland, and Cross River, the numbers are going down because there's not much of an economic incentive to keep them. And so tourism, I guess, is a necessary evil. I do talk about it. I have a chapter in my book saying, is tourism a necessary evil? And I'm glad Lorraine enjoyed my book. But the other problem we have is as the numbers are growing, which is the case for the mountain gorillas, the space for them to expand isn't. So they can only grow so much before they can't grow anymore, because we find that it's the gorilla groups which are habituated for tourism that spend more time outside the park, because now they've lost their fear of people and they're going back to places where they used to range before their forest habitat was cut. And so we're trying to convince people to sell their land, at which many people are willing because they can't do much with their land. Baboons come and destroy their crops, bush pigs, gorillas as well. Actually, baboons are a bigger problem, but they complain more about gorillas because tourists are paying a lot to see them. And so we're trying to basically expand protected habitat for gorillas. But at the same time, we also feel that this One Health approach to conservation should also be scaled up in other areas where other gorilla populations are found to reverse the trend that's happening. And in some cases, tourism may never happen because of rebels and insecurity. But if you can have social enterprises like Gorilla Conservation Coffee, where in DRC people grow coffee, even if they don't have much tourism, you can still support community livelihoods and they don't have to enter the forest to poach. And eventually this results in reversing the trend of gorillas getting killed, either through retaliatory killings or picking up human diseases or things like that. So yeah, the future is bright as long as people are benefiting from gorillas and as long as they're becoming more healthy and hygienic and their well-being needs are being met.
Thanks, Gladys. We have another question from Abby. Great talk. Have the guidelines on when to intervene with the gorillas changed over time? So do you intervene earlier now when you see that some disease is starting to spread in the population?
Yes, that's a great question. It's people are much more willing now to touch gorillas when they get sick than they were 30 years ago or 28 years ago when I started out. Now it's much more like, okay, a gorilla's sick. Let's see what we can do. And we still maintain that it should be human related or life threatening. We don't just go in for every sick animal because then they become too dependent on human intervention. So the whole animal welfare within conservation still has to take into account conservation biology. And if two animals are fighting, two gorillas are fighting, and the wounds are not severe, you let them fight it out. And you know that maybe it's time now for, the elderly silverback to step down, and the younger one now takes over and starts mating with the other ones. And sometimes we don't intervene, but then if it gets too severe, then we intervene. So yes, we do intervene more, we do intervene quicker to prevent disease outbreaks. But those principles of biology, natural selection, they still come into play because you're dealing with wild animals. You're not dealing with you're not dealing with domesticated animals. As much as habituated gorillas have sadly become quite dependent on human beings to survive in as much as the money from tourism then supports them. And when they get so used to people, they don't know who's bad and who's good. So the problem is once you habituate a gorilla group, you have to follow it every single day for the rest of its life, whether or not they're tourists, because when they meet a poacher, like what happened to Rafiki, they can easily get killed. So we still have to keep monitoring them like that. But when they get sick, we don't rush to treat them unless it's human related or life threatening. So even if we find parasites in the gorillas, which you're likely to find because they live in a dirty environment, we only intervene if the parasites, the worms, for example, intestinal worms, are actually making them sick. And so it's not like a case of you intervene every single time, but you do intervene more than you used to. It's become much more acceptable, which is great.
Thanks. We have another question related to this one, I think. It's coming from Natasha. So this was such an inspiring talk. Thank you so much for your work. Could you give us more example of decision making you need to make when choosing when to intervene as a wild vet? So as opposed to let the natural selection do the thing.
Yes, we intervene when it's definitely if it's human related, you have to intervene. Like if a gorilla has a snare, that's obviously human related. The rectal prolapse, we didn't know whether or not it was human related, but it was life threatening and we had to intervene. So if it's human related, we do. And unfortunately, us as humans, we've already affected them by cutting down their habitat. So already we've really intervened with them. And when they come into community gardens and get sick, we've already intervened, affected them enough that we have to intervene. So if it's human related or life threatening, we intervene. But if it's not human related, we shouldn't really intervene. I mean, Kanyonyi, my favorite gorilla, actually died because he fell off a tree and never recovered in spite of treatment. And then he got into a fight with another silverback who wanted to take over the group, which is normal gorilla behavior. And he eventually died. He eventually died because he never recovered from the infection. And so that was a combination of things. But definitely because there's so few in number now, it's important to intervene. But there's no point in intervening if a gorilla has a wound, which they can actually lick over time and the wound heals. Because if you keep intervening, then when you have a big problem, they can even start to develop multi-drug resistance because you're over intervening. So that's something else that we're actually quite concerned about. And we try and also another thing we found is that it's becoming more and more reported that great apes actually use medicinal plants. And it's been seen, I don't know if you heard about the orangutan who put a leaf on her wound to get better. Chimpanzees, there's been recent papers from Budongo Forest where I first did my research, and they've seen a lot of medicinal plant use. And that's something I'm very interested in with gorillas. And we've started to work with other scientists to look into this because there are certain worms, leaves that will take when they have a huge worm burden and the larvae comes out in the leaf, and different things happen and the worms come out. So it's just looking at all those other ways that they can also self-medicate themselves. But it's definitely still a bit of a gray area whether or not to intervene. But for sure, if it's life-threatening, it's very important for us to intervene anyway, because we also don't know whether it was human-related or not.
Thanks, Gladys. We have time for one last question, very short. It's coming from Luke. Amazing work, ladies. So great to see your work going from strength to strength. What would you say is currently the biggest challenge facing the gorilla population?
I would say right now, the biggest challenge facing the mountain gorilla population is a lack of space for them to expand. And there's a lack of space because we've been successful in helping the numbers to grow. All of us who worked with mountain gorillas, but now they've run out of space to grow. And that's a big problem because there's so much tourism coming up now that the pandemic has come to an end. And there are people building lodges all over the park, and they're going to lock the gorillas in. So these community members, if we don't buy their land for public good, the government doesn't buy it and the NGOs support the government to get it, they'll sell it to a lodge, and then the lodge owner will say, oh, come and stay at my lodge and gorillas will come and visit you. And of course, that's bad for the gorillas. And so we're trying, we're fighting that whole thing because someone can sell their land to anybody. That's the problem with the mountain gorillas. And also the tourists who come with all these, the disease from tourists is a very big issue because they get really close to the gorillas. Thankfully, now everyone wears masks and they have to be really healthy. But still, some things, some people may hide their infection or something like that. So the biggest threat is really disease and also still not enough habitat. But with all the other gorilla subspecies, habitat loss continues to be a big problem. And poaching as well. There's a lot of eating of gorillas and chimpanzees in other countries. They're all very much part of the bushmeat trade in other countries. And so for them, there's even that issue of the bushmeat trade, which is a big threat. But for the mountain gorillas, bushmeat trade is not such a threat. The main threat is habitat loss and disease. Whereas in other countries in Africa where gorillas are found, poaching of gorillas and the bushmeat trade is there in addition to habitat loss and disease to a certain extent.
Thank you. So thank you, Gladys, for this wonderful talk. It was really amazing. So we hope we all enjoyed as much as me. And you can now leave the station, Gladys, and have a great end of day.
Thank you.
And we will continue with the break. And let's see in a few minutes for the start of the session with the small talks.
Thank you so much. And later on today, I'll be in a Q&A session with anybody.
That's perfect.
Any of the students who want to join, everybody who wants to join.
Because you have much more questions. So yeah, thanks a lot.
Bye-bye. Thank you so much.